This is the PlaceOS podcast. I'm Landell, the sales director and podcast host today. PlaceOS is best known for working with smart buildings and workplaces where businesses like PwC, Deloitte, and NTT use our platform to connect technology and build a user experience on top. But as an integration platform, PlaceOS is also used for some special projects that have nothing to do with buildings. I personally have a passion for improving healthcare and patient experience with technology. So when New South Wales Health first spoke to us about what they wanted to do, I was really excited to be involved. The idea was to use their video conferencing platform, PEXIP, and build the health workflow around it so that it met their clinical needs. The resulting solution we called My Virtual Care. Donna Parks is my guest in this interview. I hope you get a sense of how good at her job she is and how great she is to work with, which is really important in these projects. But more importantly, it's just great to have passionate, hardworking people in our healthcare system, a system that most of us will have to access at some point. In this interview, we talk about the evolution of telehealth in New South Wales. We address specific features of My Virtual Care, the solution we developed with them. And we discuss the advantage of using a platform instead of just buying a product or instead of just starting from scratch. And I think that the market is starting to understand this a little bit more. I think we do pretty well at only using one acronym, and LHD is a local health district. This interview is also a little bit of a peek behind the curtain into the discussions that I have with clients about the next business requirements and growing the solution that they have with new features. Now that they have 3,500 clinicians using the system and 1,700 responses to a patient survey, they've got ideas for what to do next and what else to bring in, whether it's an integration or an aspect of the interface. I really hope you enjoy this one, and I hope that it gets you thinking about what other problems a platform can solve. Donna Parks, how are you?
Oh, Landell, we're coping. I think that's probably the best I can say. The last 8, 9 weeks with COVID in play in New South Wales has been challenging, to say the least. But it's just been such a wonderful time. If we could ever ask for a silver lining, we're in it. And certainly the uptake of telehealth over the last 8, 9 weeks has just been extraordinary in this state. So yes, we're coping, and we're still smiling because at the end of the day, it's just been such a rewarding 8, 9 weeks.
Absolutely. I mean, they must have turned to you and just said, "What are we going to do here with telehealth?" And you went, "Oh, bam, here's something we've been working on for 12 months."
Yeah, so that's been pretty much the response, and we're fortunate that we did have a really good partnership with all the LHDs and specialist health networks across the state. And we work pretty closely anyway, so there were certainly the ability to upscale, and all of the LHDs have really charged forward to bring a lot more people to support the use of telehealth in their LHDs. But yes, it's been pretty
Mhm.
much like, here's something that we prepared earlier, because it's telehealth isn't new, obviously, but for some people it is very new, and for particularly for some service providers and clinicians that really haven't had, to use technology before. It's been a real learning curve for them.
Yeah, absolutely. And you guys must be run off your feet with supporting that.
Oh, look, it has absolutely been flat out. I don't think any of the telehealth managers and leads in the state, including myself, actually had a weekend until about 7 weeks in, and that sort of also included the long weekend. So it was not something that we really expected. Our usage of clinical services, it's easy to give somebody a platform to use, isn't it? Particularly if they're using video conferencing, but it's how do you train them? But it's more so the model of care that comes before that, and making sure that the care that they're delivering is clinically safe. So saying we've been run off our feet is probably a true statement. It's been a very chaotic and time pressured environment over the last period of time, but we're all still smiling and we're here, so it's a bonus. And we haven't had any of the telehealth support people that's come down with COVID, so the workforce is strong.
Oh, and I have to say, you've done an excellent job. I mean, just shouting out to all of the health workers and everybody who supports those health workers through tech or through administration. especially in New South Wales. Like, what a fantastic job you guys have done.
Yeah, look, it
Um,
is extraordinary, isn't it? A lot of people come
yeah,
together to make it work.
yeah, absolutely. Now, New South Wales Health have been using telehealth platforms for a while, and you alluded to that just before. It's not something new. What was the main driver for that initially? Well, I think it's very clear why you would use telehealth platforms in the sense of, when a pandemic arrives or when there's an infectious disease that you want to keep people out of hospitals. But what was the original use for telehealth?
Look, yeah, as I mentioned, telehealth's been around for, probably 20, 30 years, where the use of video conferencing, but a lot longer for that with the use of telephone. And I think, just to clarify, when we talk about the umbrella of telehealth or virtual care in the same context, we talk about telephone, video conferencing, the use of email for asynchronous messaging, or what we call store and forward, and we've also got the use of remote monitoring or the inclusion of apps. It probably is much more mature, I would think, or it certainly is much more mature in the very rural and regional areas of New South Wales. And that was probably purely out of necessity. And generally, it's about access to care. So, our workforce can't, we can't have specialists everywhere in the state. Unfortunately, we just don't have enough people that are skilled appropriately to deliver all of those specialist services that exist in this state. Telehealth really came about due to necessity to being able to provide equity of access to clinical care, and I think from there it started to grow and is certainly now a modality that we see across our whole state, including into our metropolitan areas. And probably so, I think probably in the last maybe 2 years, the metropolitan services have really started to think and adopt telehealth purely based on the fact that it is actually very convenient for their patients as well. Even though they're in the city, it is still such a challenge to get across the city sometimes. And then there's also things like parking, but generally, convenience is probably one of the main things that patients talk about. But certainly, from a clinical perspective, and there's always benefits for clinicians and also for the system in itself.
And for the patients. I mean, I've had to have, get my little boy antibiotics and seen to, and to be able to do that as a virtual consultation while I've got my other child at home. So we can wait in a virtual waiting room at home rather than having to lug the both of them down to a doctor's, and you can't always get in with your GP when you need them. And so you have to go and see a random GP, but then it's just for an antibiotic script where you can sort of already it's just so much more convenient, even for a parent like me, to not have to drag two kids to sit in a physical waiting room for something as simple as an antibiotic script that can easily be distributed to us.
Yeah, look,
um,
absolutely. I think, it's about whether, things are actually, or clinical services are clinically appropriate to deliver. And I think what COVID has really brought is the opportunity to take a fresh look at the way that we offer care. And, traditionally we always expected people, that's just the way it's been. You go to your doctor. um, the thought of actually receiving your care in a convenient time and not having to take, whether it's children or being able to connect into appointment because it might be your elderly parents and you're at work. So it's total convenience and it gives people options. And I think that's what the exciting part about this is because one, it can also integrate other care providers in, so it also reduces the need to tell your story more than once.
Absolutely. I really loved talking about that in the user stories, actually, from thinking about a physical building or multiple buildings and having to have separate specialist appointments that you have to travel between or, put on different days. Whereas virtually, that's just a transfer into the next waiting room. So you can go from the endocrinologist to, I don't know, the renal specialist or whatever it is if you're a diabetic patient. I found those user stories really interesting, and when the problems were presented to us as far as here's the kind of care that we want to give, and here's some of the thoughts around how we produce that workflow, getting into the nitty gritty of like how patients really have to kind of adapt to the system rather than the system working for them. Yeah, I think it was just a really interesting use case that we hadn't probably entertained before really getting into it with the telehealth managers. Can I ask you? So we get questions all the time about buying versus building new systems. So I think traditionally in the market there was products that you could buy, and then or you could go with a custom build of a new system yourself. And what that meant was buying a product, it might get you 80% there, but it might not be 100% for the workflow that you need. And then building your own system, well, that's a lot of time and effort to build it from the ground. So where we sit as PlaceOS is kind of in the middle there. So we're starting with the platforms, but you're not starting with from scratch. And then what we did was just a lot of customization. So can you tell us from your side, I just alluded to it actually, but can you tell us from your side who was involved and how do we do that next phase better? So who was involved in this customization build and who will be involved in that next phase?
Yeah, look, I think it has been such an enjoyable process, and I do like the fact that we've used the best of both worlds because we have had products obviously before that haven't really totally met our clinical need, and there's probably some particular things. For large facility or large services such as New South Wales Health, that we have such a large workforce, and the requirements that clinicians identify are very like a huge really in a way, and it's about listening to the clinicians around what are those things that they need to be able to conduct their work appropriately, particularly when they're trying to do it via telehealth. So our first role with pulling this together, we had a lot of telehealth managers, or we had a section. I'll start that again, Landell. Blah, blah, blah. um, yes. So moving forward, the iteration that we've done now with my virtual care really included a number of telehealth managers and leads across some key areas that had a lot of experience using video conferencing platforms and had been using telehealth for such a long time. They obviously have a lot of feedback from clinicians, and we didn't involve a lot of carers directly in the build of this. And I think that carers and patients in the next one, we would really like to get some representatives from the carers and patients themselves. And I think now that we've got the platform up and running, and be keen to talk to you about some of the feedback that we're getting out of the survey about the platform for you, is that there's a lot of clinicians saying, wow, I really like this, but can it do this too? And so they're actually coming to us and telling us about some of the things that actually would make a real difference, because the video conferencing component of it is one part, but that's not their total workflow. So there's other things, and whether that is a signed consent form around the medical treatment that's about to happen, or whether that's signing off a Medicare form, or there's a whole range of different enhancements that have been flagged with us that have come now directly from clinicians. And I think in the beginning it was a bit like, oh, okay, another platform, and where will this lead to? And it's been something that's been so rewarding to get to this point where we're at the moment.
Yeah, it's pretty exciting for us too, and I have to say the process was a massive learning curve. Because even though I've worked in healthcare before, it's eye opening when you see how other people have to run their day,
Oh,
and all of the things that touches, and to have to, it's a little bit funny in a way that you go to a doctor and there's still so much manual things that you have to do. And so a lot of this conversation around digitizing and creating the workflow that supports those clinicians but also the patients, that was a really exciting project for me personally. So yeah, I think both sides of the fence were pretty happy with the process and learning from each other. But what was the kind of rationale behind sort of going halfway and not buying off the shelf? Because I guess nothing was going to really suit the New South Wales health workflow, and then not starting from scratch because that was going to be way too expensive. But you guys had a pretty good video conferencing platform in PEXIP and you were using it already. It was just more about trying to figure out what features should work around that workflow, right?
Yeah, absolutely. And I think too, one of the key areas that made us consider that was really the fact that we had a lot of people that were very familiar with the key functionalities of PEXIP. And so to bring in a new platform sometimes is a bit daunting, because when we look at the level of staff in New South Wales that have been trained and supported to date, we didn't really want to lose that momentum and get people feeling like we're just changing for change's sake. So we really enjoyed the fact that we could have a platform and then like in essence lay a skin over the top of it and have it look and feel, have that consistent look and feel, which is really important for us. In the current climate, we have patients that access care all over the place, and so today they might be linking into from a rural area into a city hospital, and tomorrow they might be linking into their GP, and then the next day they might be going into their nearest regional hospital. And each time that they log in to do some virtual care, they are presented with different looks and feels about the different types of technology. So not only is it much better for our clinicians, we're trying to get that really simple single point of access for virtual care across our state.
And I have to say, I should have said this earlier, but one of the things I love about it, and I think you mentioned it before, was that you have the ability as a participant, like a third party, to come in on the call. So if you're a family member or a carer for somebody, you can actually join in on their virtual consultation, or they might even be in person with a clinician in a regional hospital, and you as their daughter or as their daughter or their partner or anything could be living somewhere else, and you're able to remote in and actually be part of that consultation, so you can be part of the healthcare as well.
Well, I think absolutely, and that's what's really important, to provide holistic healthcare to patients and their families, because the patient isn't the only person that actually is a part of that process of supporting somebody's recovery, or managing an illness, so to speak. So being able to bring people in, and this platform certainly gives us that flexibility, because we can have the patient face to face and bring in their GP, bring in their family members and carers, and they can be on holidays overseas if they need to be, or if that's where they happen to be, or we can have everybody virtualized. And so often elderly patients talk about the inconvenience that they cause to their children when they are wanting to attend medical appointments, because they might have to take a day off work, or basically get the kids childcare, etc., so that they can actually attend the appointment with their parents. So I think this also gives that greater flexibility to actually say, well, in my lunch break, or I can plan my break at work and go into a quiet area and access that and be a part of that. And that also provides a much clearer approach to the person's healthcare, because everybody's in the know. And again, it reduces the need to actually repeat something. And I don't know about any of the people out there listening, but my parents come home and sometimes tell me something completely different to what was
Yeah.
actually said, and then you go, and I'm fortunate that I work in health, and so I might pass the person in the corridor and say, "Oh, how'd that go?" And they say, "Oh, yes, I'll talk to because obviously I'm listed as a carer on my parents' plan, so they're happy to have a conversation with me about it." But what my mum sometimes would relay to what they relay can sometimes have a lot of distance in between. So I think that really gives that opportunity to be able to be a part of it and say, "Oh, no, mum, this is what they really were meaning when they said this," just to re-clarify to some of the understanding. But what I really like about it is that, if a person has a broader care team, whether that's with an NGO provider, their GP, their family and carers, and other people around them, it gives us the ability to bring people in and be a part of the conversation, and participate in what the plan should look like.
Yeah, it's so good. That's a common problem, I think. When I think, you know, you have patients who they might be receiving bad news or test results. They might go into some kind of shock. They don't have a medical background themselves, so they might not understand all of the terminology they're being told. If they're elderly parents, they might even have hearing problems or, you know, like can't hear every word. All of that creates, you know, a disaster for communication, and to be able to be a part of their appointments as a you know, as their carer, as their daughter, that's really important to me. So yeah, it's so good that we've catered for that workflow. Now, something that you know a lot about as well, and something that the world is just kind of cottoning onto, is remote working. Where are you based?
Look, I'm based in Dubbo, and I was actually moved out of my office because I was based in a hospital at Dubbo Base Hospital, and moved when COVID hit. I had my desk delivered to home 2 days later. Purely, I was in an environment where I had doctors around me, and as the state telehealth lead, I really needed to make sure that I was in a safe environment as well, not only for myself but also for my family, with a lot of elderly people around myself. So I'm been working from home now properly full time for the last 8 weeks. It has its ups and downs, particularly when you've got your children not at school. But I think it's a really different way to work.
Well, I think that what's important as well. So, for listeners who don't know, Dubbo is part of Western New South Wales. It's a regional area. It's not in a city centre. How far drive is it from Sydney?
Look, yeah, you can do it in 5.5, 6 hours. Yeah, so it's a fair distance.
Yeah, it's a fair distance. And some of these, you know, important jobs, like a New South Wales telehealth manager with for clinical innovation, when businesses are open to it, they can get the right talent and they can base them outside of city centres. And I think that you know, we do that as well with our work, because if you've got sort of roles where you can trust people to work remotely or work from different offices that are decentralized, you can also get the best person for the job. So we've got developers who live part time in Mudgee, which is another rural area, in rural Tasmania, which is a bit random, just because they're really good at what they do, and so there is no need to sort of make a workplace necessarily for them. Or yeah, like I think that your experience with working remotely is, I don't know, it's just topical, I guess, at the moment.
Yeah, look, I think we're all rethinking the way our workplaces should be, and we're virtualizing our workforce. And no longer do we need to be, in four walls, and an office isn't sometimes the traditional office anymore. I mean, certainly. The organisation that I work for, which is the Agency for Clinical Innovation, everybody's been working from home since we've been in COVID, but we always have had, flexible work arrangements, which I think is important to be able to attract and to retain staff. But I think now that COVID has been, it's sort of really made people realise that there is more to what a real workplace looks like. And I think we should encourage more people to look outside the square. I mean, certainly my role, when it was first advertised, it actually wasn't advertised as a position that could be filled from anywhere. I actually made a phone call and suggested that, or challenged it really, and was fortunate enough for them to be able to see the potential in that, and then obviously went through a normal merit selection process and was fortunate to get the job. So. I mean, they have to obviously be open to that as well, and I think in the mentality of how places have traditionally been, that's all being turned on its head, which is, an exciting time for people because, you can be working for a company based in London or in Sydney and really be, in a remote community like Dubbo.
Yeah, absolutely. Now, you started your career as a teacher before moving into healthcare, so you're a bit of an angel by nature, right?
So they say, "I've got plenty of patience." So yes, I did start out as a primary school teacher. And I went to uni in Bathurst, which is another rural community, and finishing my teaching university studies, I went and taught in a little place called Gilgandra, and then after that went and taught in London for a couple of years, and then obviously came home to Dubbo for another couple of years, and then I moved into health. Just by sheer sort of health promotion and early intervention, because I had a bit of a passion for education and early intervention with a mix of health. And then, yes, long story short, that's about 18 years ago, and I've worked in mental health, in child and family health as well. I've worked for NGOs with Mission Australia and with Royal Far West in Manly as a rural and remote service manager for several years, and came back into health for in the integrated care strategy, working out in Walgett, which is about 3 hours west of Dubbo, and then saw this job. So yeah, I've had a bit of a career that has gone in many different directions.
Yeah, wow. It's a career of service, I guess, and I think it being a parent of a kindergarten age child, we are learning.
Especially in
Uh,
these
I
times.
Oh God, I am learning just how much creativity teachers must have and how much patience, because you can't be up every day. And I've got one kid who's like, nah, I don't want to do it. And imagine you had one kid every single day or every single exercise in your class of 18 or 20. I think we're learning more and more about just how special teachers are.
Yeah, I think
Um,
everybody's appreciating them at the moment, which is lovely because it is, it's a real skill to be a teacher, and hats off to all of them that, do it day in, day out, and it's often a very thankless job. You might get a present at the end of the year, but you really are guiding and shaping that person's, education and decisions in life. And it's only a small part of it, but certainly parents play a big part. But it is really a good way to support shaping a child's future.
I know that you are, absolutely run off your feet. So I didn't want to take up too much time, but I did. Thank you so much for agreeing to do the podcast, because I think what we've built as far as my virtual care as a product on Place OS is just really important, and I can't wait to see what happens next. I really just wanted to say to you that we've treated this as a partnership with you guys, and I know that you have too. And I wanted to say thanks for working with us and removing any of the finger pointing that happens in projects, and you really removed all of that when little things went wrong. So it's been incredible to work with you and to put this solution out there at a time when it can really help a lot of patients and health workers. And that, going forward, I hope that this just gets bigger and bigger so that people can access top-notch care more conveniently. So I just want to say thanks for your vision and your perseverance, and your team should be really proud of the work and the effort that they've put in to date. And yes, just thank you so much.
Thank you very much. Landell, do you want me to talk about some of the survey results?
Oh, yeah, can you?
Yeah, because and the other thing that I think is probably worthwhile, and so you can chop this in later, like put it
Yeah.
in, into it. But we've got 1,714 people that have actually responded to the patient survey, and yeah, I can talk to you a bit about, some of the feedback that we're getting from clinicians about, because and if we don't treat it as, we haven't, moved to production, maybe if we talk about what the expansion, like the increase that we're expecting over the next few weeks, and so that nobody's really hearing that, we've got this many people in UAT. But do
Yeah.
you want me to talk to that sort of stuff?
I would love that. Yeah. Because I think, I mean, it would be great to hear it anyway, because I think we need to be starting to
Oh, we don't
grow.
need to. Yeah, look, I mean, we've got over 3,500 clinicians using it. Like, that's extraordinary. And, even though we are in a UAT environment, it's not something that we ever expected to get to that big. And, in the short period of time, the feedback from the clinicians, and there are LHDs and clinicians that are basically saying, "When can we have it?" And I think that is, real testament to the fact that, we've kept it pretty hush hush, because what we didn't want to create is extend the platform or the availability of the platform in the middle of, a pandemic. We already had large numbers of people actually using the platform, and clinicians talk to each other. And I think that's word of mouth is the best way that you can, if you pick up people through word of mouth, and you know that it's actually something that people are passing on, saying, this is a great product, you should try it, or this is a great tool, why aren't you using it? Which is pretty much what is happening in New South Wales Health. We've had that many clinicians actually saying, when can we use it? When is our LHD coming on board? So I think that's, a really exciting thing for you guys to be aware of as well, because it means that we've created something that is of value, and certainly provides some, further opportunity to grow it further. But as it is, people are desperate, or not desperate, I wouldn't say that's the word, but they're really wanting to use it, and to the point where they actually don't want to go back to the other platforms that they've got on offer. So, that's a huge testament to everybody, that's been involved in this, and, we've had some long days and some challenging conversations along the way, but, that's what software development is, really all about, because everybody comes to this with a perceived need and interest, and, it's about working together to actually make those things a reality. The other thing that I just thought was really interesting is that we have a patient surveys that pops up for our patients to answer at the end of their consultation. Over between the 30th of January and the 4th of May, we've had over 1,700 responses from the survey. And I think one of the loveliest things that we've seen is that out of 5, the overall rating is 4.33. So, there was so many wonderful comments from patients that were, basically thanking individual clinicians and being able to access their care in this way, how easy they felt it was to use, and how convenient it was as well. But most of the, to get a rating like that at this point, when we've really only been using it for a short period of time, is really quite good. The other thing that I would love to share with you is that one of the questions said, will you consider receiving further care using my virtual care? And 92% of people replied yes, or 92.8. So that is really wonderful. And out of the 7% of people that replied no, it was more so about, I really do like, going in and seeing my clinician face to face. So it certainly wasn't because of the platform provided any problems for them. It was more about their own personal choice. So that is absolutely huge feedback, really, particularly when we're in a place in New South Wales where virtual care probably wasn't, a norm, and where COVID has really changed the way that we look and receive, or look at and receive healthcare, and that's certainly pleasing to see.
Yeah, that's awesome. And we, like, that is just so good. It makes a lot of that worth it, doesn't it? All of those kind of nitty gritty details that we had to get into, and then for the decisions that we made based on that, and then to have 92% of people say that they'd use it again. That's exactly what we want to be up. Like, that's amazing.
Yeah, it's
I was
fantastic.
blown away by that, actually.
Yeah, we'll send you the survey results for you, as where they're at the moment, just for your own information. But there's other little questions around. What benefits were there for you, and these are directly at patients. And 70% of patients responded totally. It was about convenience. And there were, I mean, obviously they could choose more than one response, and so then the next highest ones were they were able to stay closer to home, and that they basically were able to receive advice to help them with their conditions without having to leave home, and allowed other members of their family to participate. And that, they really just felt that it was really easy and convenient. So, I think it's fantastic that there's such a positive impact around accessing care, but also using my virtual care.
Yeah, and it's, I mean, the trend for telehealth was already there. People obviously had a demand for it, but I think COVID's just accelerated those trends, much like they have with, like, working remotely and having video conferencing for meetings and things like that. It's kind of the thing that's forced people into into really analyzing what's the best way to do this.
Yeah, that's right. And I think in some circumstances, a pandemic is, whilst it's, not the best circumstances for people's own safety, they wanted to, it was important for them to still, be accessing their healthcare and continue to manage and monitor their own care. But they also sometimes felt like they were putting themselves at risk going into a health facility. So, um, if you can still receive that care that you need at home or in the comfort of your own home, or if were able to remain at work, then I just think that was something that has been hugely beneficial for just maintaining our own level of health during this time.
And what are some of the features that they're requesting? Like, what are they saying would be great if they had?
So, from a clinician's perspective,
Yeah, yeah.
yeah, so some of the things that they're talking about is being able to, there's a lot of duplication, obviously, sometimes when people are in one system and they have to go out and report their activity. So, whether they can actually report their activity in the system. So, if we can somehow manage that, certainly the ministries agreed to support that. There's been a lot of interest around the signing of forms, so being able to have, like a form uploaded, so it becomes, a Google Doc form that you can, just sign. Um,
Like a
I,
sign or something like that. So for the first one, we could integrate with something like a electronic medical record, so that anything that you're typing into your notes could be then stored against that patient in their EMR.
Yeah, so that is absolutely something that we can talk about. I think in the next iteration is really about that integration into the EMR. But then in further to that, like we actually have to report our activity and how we spend our time, and so that's another system that people have to do. So there's so much duplication, and it's really not that difficult and time consuming, but it's still another thing that they have to do. Um, Other things around an app, there's things that we've actually raised and have been resolved as well, like being able to mute the participant from the other end, and being able to remove your self view. So those things were already being able to do. You spoke about the transcript of the waiting room. So being able to move that into a medical record, adding a recording solution to it. Somebody asked us to put a clock in the top corner so that they could keep track of time. Whether it could integrate into the booking schedule of the systems, because obviously this isn't it's not a booking schedule, like scheduling tool as such, but patients do enter the time of their appointments, but being able to totally integrate those down the track would be interesting. Adding in symptom checkers, so people could check off, some of the things that they're feeling today, or even identifying specific clinics. So we've got one room in North Sydney LHD, which is an outpatients clinic, and there would be something like 300 clinicians in that room, and there's five to ten services that are run out of that outpatients clinic, but it's all a part of one outpatient clinic. So when the patient comes in, the clinicians see everybody in that outpatients clinic. So we are revising those types of things, but there's been some things around that. And then even people putting in their postcodes or their address and actually identifying the distance between the two call or the participants in the call. That's really good. Yeah, so that's a really cool one to be able to think about. But we don't want to give our competitors too many ideas, so we might keep some of those under wraps.
Oh yeah, for sure. But even with competitors, there's nothing really that's doing the
Any
same thing.
different? Yeah,
Yeah, well, because to build that, our competitors would have to like build it from scratch and hard code it all. Whereas when you're building it with Place OS, that's you're just talking about integration with different products and then a couple of front end changes.
yeah,
Like
that's it.
that's the benefit of it. You could get that done pretty quickly. The trick is always with the processes of a government organization and then the APIs on the other end of the dependencies that we would have. So like whether the EMR system would allow us to connect via REST API and write information to their system.
Yeah. That'll be really interesting. I mean, there was even, one of the features that the development team picked up, which came in, rather late when we were doing a demonstration. Like, the system was already in use. Was really around the risk around displaying clinicians' last names, particularly with services that they wouldn't normally show their patients their last names, just for some added privacy and confidentiality. And so, your team, or Place OS team, really worked to. I mean, they totally understood that, and they were able to meet the service request, to be able to, remove and or change the details of the clinician if needed be, while still being, logged in as your normal name. So being authenticated under your own name, but then showing up on the screen as a different name, which might be, your maiden name, or it could be just your first name. Or sometimes we've got doctors with such long last names that, particularly if you're a pediatrician, you might not be known as, the doctor with the long name. You might be just known as Dr. Bob. And so you can actually pull out your last name and write, Dr. Bob, if you wanted to. And I think that really, there's some of the things that really makes this solution really unique and fit our needs. So, there's been nothing really that has really challenged the team, and they've been fantastic to work for. So we certainly can't fault it. It's been such a great experience.
Ah, likewise. Can I ask another question just about the types of people who are accessing my virtual care at this time? Are they what's is there any data about like what the patients are coming in for?
Look, we've got something like 90 clinical services in the system at the moment, and just while I'm talking to you, I'm just opening that up to be able to talk to it in a bit more detail for you. And I think, one of the key things about my virtual care is that it's just been so flexible for us to be able to set up our own clinics and be service specific if we needed to be. So that's been, absolutely fabulous. But we've got health and fitness coaching services. We've got a lot of mental health services, palliative care. We've certainly got hospital in the home services, paediatric services, people recovering from surgery. Also, there's rooms in there. Lots of child and family health and women's health services, and a lot of aged care services into residential aged care facilities. We've got a burns clinic. We've got a lot of cancer services, whether they're radiography. Oh, sorry, I said that wrong. A lot of cancer services that are in there for oncology and for radiation. There's cardiac services. There's genetics, home nursing, endocrinology, diabetes services, certainly a lot of neonatal and neurology services. We've got some really interesting clinical trials or research projects that are using it as well. Allied health services such as occupational therapy and pharmacy, social work. So this, we've got orthotics even that are using it. So I think that there's certainly so many different services that are using it, which is fabulous to see. Pain, cystic fibrosis, like the list goes on. I just think that it's such a flexible platform that it just really reflects the clinical workflows of our services, which is why it's been so easy for these clinics to get set up and start using it.
Oh, wow. That's just such a big breadth of patients. And yeah, what's interesting is that as a layperson, a pandemic hits and you go, oh, shit, like, the health system's going to be under so much strain. And you're really just consumed by, news after news of, coronavirus counts and deaths and all of that. But really, it just adds to the workload. Like patients with cancer and diabetes and heart disease, they still go on, and then there's side effects of even an uptake in like an increased risk of domestic violence, or the increased like I was listening to a podcast this morning about domestic violence rates and people presenting in South Australia or Queensland, It's not necessarily that there's more events, but they are actually more like the injuries are much worse than what they are normally. So the combination of having people at home, stuck at home, more alcohol, lost jobs, money stress, all of that, and the incidences of or the severity of domestic violence going up, and people. So it's just it just brings into the forefront that how important the healthcare system is, not just for a pandemic, but for all of the things that happen. And to have tools that you can customize to that workflow is just that's just a really important thing that we can kind of contribute to. It's nice.
Yeah, well, I mean, our tools are our, lifeblood really to be able to get our jobs done effectively and efficiently because, you're right, the doors don't shut when a pandemic hits. Care needs to continue. And for a whole range of services, if they don't, people become very unwell. And sometimes, if things are mismanaged, you can't always revert the symptoms. So, I think it's been really important that we've had platforms that we can, have been able to just enhance really quickly with their capacity to be able to meet the demand that we had come through our doors. I think in 1 week we had over 200,000 people join our platforms, and that's across all of the platforms that we use. But they were participants that were accessing care, so that's extraordinary when you hear stuff like that because it's like, wow, that's a huge amount of people. And we certainly have seen the graphs from in February, where the rates were of the number of calls, etc., and then how quickly that went up. So in New South Wales Health, we had to increase the capacity tenfold to be able to cope with the demand. So where we were able to, have 2,000 calls at any one time, we now can have 10,000 calls. So, it's, something that's just had to have happened for us to be able to understand, the needs of the community and to be able to keep people healthy.
Those numbers are staggering.
Yeah, it's extraordinary, really. And I think, at the end of this, when we all get time to actually take a breath and, we've got our frontline workers and we've got all of the unsung heroes, standing behind right from our cleaners to our telehealth people, the people delivering the stock into the hospitals, all of that sort of stuff. We've got so many people that there's nobody that's been insignificant in being able to meet the needs around COVID to get where we are today, and that's a true testament to everybody really that has been in this situation or been helping in this situation because we flattened that curve purely because we had a massive everybody was just banding together, and everybody was so thankful that people did hear those needs to take self-isolation seriously because we didn't really want a repeat of what's happened overseas, and at this point we're very fortunate to be where we are.
Yeah, for sure. Oh, well, Donna, stay safe. Thanks so much for your time. You're just good to talk to.
Oh God, thank you so much. I've just enjoyed myself so much. uh,